So let's start the Nclex orientation. Nclex orientation. First of all, we have to learn the Nclex full form. That is National Council Licensure Examination. And Nclex is a national licensure examination for nurses in the USA, Canada, and Australia. What the purpose behind it? So to determine if it is safe for you to begin practice as a entry level nurse in the country of USA, Canada, and Australia. Nursing school exams are knowledge based. The NCLEX are a test application and analysis using the nursing knowledge you learned in school and colleges. You will be tested on how you can use critical thinking skill to make nursing judgment. It is being developed by NCSBN, National Council of State Board of Nursing, and is administered by Pearson VUE. NCLEX RN is approved by all nursing regulatory bodies. NCLEX RN and PN. Development of test plan, legal scope, State Law and Regulations, Practice Act. Practice analysis study. Activity statement newly are asked for applicability, frequency, and importance in client safety. That is two development of test plan, that is legal scope and practice analysis study. Next, test plan. There are three test plan. Level of cognitive ability, client needs integrated process. Let's look into it. Level of cognitive ability. So in which knowledge, understanding, applying, analyzing, synthesis, evaluating, and creating. Uh, Knowledge. First of all, you have the appropriate knowledge of what is nursing and what comes under it. So knowledge, understanding, applying, analyzing, synthesis, evaluating, and creating, that's all comes under level of cognitive ability. Exercise. The nurse note blanching, coolness, and edema at the peripheral intravenous site. On the basis of these findings, the nurse should implement which action? So remove the IV, apply a warm compress, check for a blood return, measure the area of infiltration. What should you do? Apply the knowledge, understanding, applying, analyzing, synthesis, evaluating, and creative sequence into it. So first, nurse note blanching, coolness, and edema at the IV site. So what did you do first? Remove IV, warm compress, check for blood return, or measure the area of infiltration. So you are going to remove the IV first, then go for the further steps. Then client need safe and effective care environment, health promotion and maintenance, psychological integrity, physiological integrity. That's all comes under NCLEX chapters and NCLEX chapters and NCLEX theory and NCLEX examination. Safe and effective care environment, health promotion and maintenance, psychological integrity, physiological integrity. First, safe and effective care environment. What comes under a safe and effective care environment? So first, management of care, in which advanced directive, assignment, delegation, supervision, case management, client's right, interdisciplinary team, confidentiality, continuity of care, priority, ethical practice, quality improvement. That all points are included in the management of care. We are move further into it, but first of all, we are shortly looking what comes under safe and effective care environment. So first, management of care, we are just go through it. And second, safety and effective control, infection control, safety background, accident injury prevention, emergency response plan, ergonomic principles, handling hazardous and infection material, home safety, reporting of incidents, standard precautions. Next, health promotion and maintenance, aging process, anti, intra, postpartum, and newborn care, developmental stages and transitions, health promotion and disease prevention, health screening, high risk behavior, lifestyle choice, self care, physical assessment, teaching and learning. That all comes under health promotion and maintenance. Next, psychological integrity, in which abuse, neglect, behavioral intervention, substance abuse, coping mechanism, crisis intervention, cultural end of life care, grief and loss, mental health concept, stress management, support system. That all comes under psychological integrity. Next, physiological integrity, basic care and comfort, in which assistive devices, complementary therapies, elimination, mobility, nutrition, personal hygiene, rest and sleep. That's all comes under basic care and comfort. Next, pharmacological parenteral therapies. Uh, Blood and blood product, central venous access devices, dosage calculation, medication administration, medical management, parenteral and IV therapy. These all are completed and included in the pharmacological parenteral therapies. This is all about physiological integrity. Next, physiological adaptation, in which alteration of body system, fluid and electrolyte balance, hemodynamic, illness management, medical emergency, pathophysiology, unexpected response to therapies. Next, reduction of risk potential, changes abnormal vitals, diagnostic tests, lab values, alteration in body system, surgical procedure, and health alteration, system specific assessment, therapeutic procedure. This is your chapter based on the NCLEX examination. Your NCLEX question is based on this theoretical aspect. Okay, so next, client needs category and subcategory and percentage of questions. So we are go through the all chapters and what comes under the NCLEX theoretical part. So now we are looking to its percentage and theoretical based how many questions are uh, are from the particular theoretical based questions, theoretical based part. So first, management of care, safe and effective care environment, we are already looking into it, and in which management of care, and this part is carrying 17 to 23 percentage of question. Safety and effective infection control, 9 to 15. Health promotion and maintenance, 6 to 12. Psychological integrity, 6 to 12. Now comes next, physiological integrity. Come to the next part, that is physiological integrity, in which basic care and comfort take 6 to 12 percentage of question. Pharmacological and parental therapies in it from this 12 to 18 percentage of questions. Reduction of risk potential, from this it takes 9 to 15 percentage of questions. Physiological adaptation, 11 to 17 percentage of questions. Next, integrated process. Caring, communication, documentation, nursing process, cultural and spirituality, teaching and learning. This all comes under integrated process. Integrated process based question, that is, a client is scheduled for angioplasty. The client says to the nurse, I am so afraid that I will hurt and I will make me worse off than I am. Which response by the nurse is therapeutic? First, can you tell me what you understand about the procedure? Your fear are sign that you really should have this procedure. Those are very normal fear, but please be assured that everything will be okay. Try not to worry. This is well known and easy procedure for the cardiologist. So, which response by the nurse is therapeutic? The answer is 1. Can you tell me what you understand about this procedure? Okay, because the patient is afraid, so we have to identify that what patient understand about the procedure, so that we can identify that what makes the patient afraid. Engine test design, total exam length. There are 85 to 150 questions, and in which scored items are 70 to 135. Unfolding case study include 18 items. In one case study there are 6 items. So in three case study there are in one case study there are 6 items, and in three case study total include 18 items. Standalone items 52 to 117. Pre-test 15, and total time allocated to this test is 5 hours. Scoring models, 0 to 1, plus minus rational scoring. This is the scoring model of examination, that in which you get 1 mark or you get 0. There is plus and minus because in SATA question there are 5. We have to look into it, but I am just rationalize that what is plus and minus. So in SATA question there are 5 options and you choose the 4 option, and there are only 3 options that are corrected. So for one question you will get 3 minus 1, so 2. You will get 2 mark for the SATA question. Like that, plus minus is applicable for the SATA question. Then rational scoring. First, 0 to 1. Used when there are a specific number of choices. 1 point for each correct response, 0 point for each incorrect response, and total is equal to sum of correct response. Used when there are specific number of choices. 1 point for each correct option and 0 point for each incorrect response, and total sum of correct responses. I already told you that in SATA question there are 1 point for all correct response and 0 point for incorrect. And SATA question in which SATA question applicable for plus minus, and 0 to 1 based. Yeah, you know now what is MCQ based multiple choice question, in which you correct one and you correct the answer, you will get one, and you if you incorrect select incorrect answer and you will get 0 mark, like that. Plus minus is applicable for the SATA question. Select all that apply. Used when you can select as many of few questions as you want. Plus 1 point for each correct one and minus point for each incorrect one. Total sum of correct option minus sum of incorrect option. I already told you that if there are 4 correct answer are there, and you will select three option, and there is one one remaining to uh, choose. So you that one remaining will uh, that one remaining, that means minus 1. So you will get my 3 minus 1. So that is 2. So you will get 2 score for that SATA question. So total sum of correct option, that is 4, and minus sum of incorrect option. Are and you are selecting only 3, and there are 4 correct options, so that 3 minus 1 is equal to 2. You will get 2 mark. Rational scoring, used for item that require you to pair information. Choose both correctly 1, choose 1 correctly 0, and choose 0 correctly 0 point. So in rational scoring there are question like blanks, 2 blank spaces are there, and you have to choose the both correct option. For example, there is question that require airway breathing and circulation. So if in first blank space you have to select the airway first, and in second blank space you have to select the reason behind the airway problem. So there are lung abnormality in one option, and second option the cause dyspnea or the symptom dyspnea. So in both of the question you have to select the both correct blank spaces answer. If you select the one incorrect or doesn't select any of them, you will get 0 mark. Standalone item, drag and drop down, multiple choice. There are the items in standalone items. So first, drag and drop, you will get spider net like questions in which you have to drag from the given option to the that's blank space. Drop down, same like the spider like questions. And multiple choice, you already know that. Multiple response, yeah, that's that also you know that. And highlight, yeah, that is for example, you given the particular paragraph about the patient condition, patient diagnosis, and from that a question asked about something, sign and symptom, diagnosis, or any of the assessment treatment, and you should have to highlight the paragraph from which the particular data we will assess that. So highlight means you have given the paragraph and you have to identify and highlight the correct answer. Bow tie, that means bow and tie. A and B, two row are there, two columns are there in which A and B. First in A you have sorry uh, you have given diagnosis, and in column B you have given sign and symptom. You have to bow and tie the diagnosis what to say sign and symptom. You have to both and tie the sign and symptoms with the diagnosis, so that is bow and tie. Next, trend. Okay, there are that all comes under standalone items: drag and drop down, multiple choice, multiple response, highlight, bow tie, and trend. First example of drag and drop. So close. I already told you that there are two blank spaces. Look at, there are two blank spaces, and from the remaining option you have to put that you have to fill that space correctly. Look at, from the PHCP's prescription and health history findings, you have to both correct. You have to correct the both spaces correctly. If you correct incorrect one, you will get 0. If you does not select any of them, you will also get 0. So drag and drop. Example, two blank spaces. Drop down, yeah. Drop down is also like drag and drop question. You have the given criteria of the patient, and from the criteria here, look at the arrow is there, and from this arrow you have given the 4 to 5 options, and from that option you have to select first blank and second blank and third blank, like that. Then multiple choice, you already know that. Assessment finding: improve, no change, or decline. You have to just select the multiple options related to it. And multiple response also, you already know about multiple response, look like that. Then multiple response again, highlight. Yeah, I already told you that highlight the particular sentence asked by the examiner or asked into the question. Bow tie, look like that. I already told you that there are spider like net in which blank space you have to fill out from the given options. Then trend, calls for you to review information over time. For example, you may review nurse's note, lab value, vital sign, progress note, medication, or other information. Any response type can be used. Okay, so you have given this nursing note, PHCP's criteria, and you have to select from that related about your diagnosis, about your assessment. Case study, you will have 3 case study on your exam. Series of 6 questions about the same client scenario. Information is added as the case study unfold and subsequent questions are asked. Recognize, then analyze the cue, then prioritize, what to say, prioritize hypothesis, then generate solutions, then take action and evaluate outcomes. Yeah, I uh, shortly I can say that case study is all about your nursing process. What comes under nursing process? There are 5 steps in the nursing process, that is assessment, diagnosis, planning, one more goal, implementation, and evaluation. That is all comes under your case study. Pyramid to success. So lastly, I can say that you have the strong positive attitude that you are capable and you will going to crack the Nclex soon. Then structured study plan. First you have the strong positive, you must have the strong positive attitude. Then next, structured study plan. Then structured study plan, you have your study plan 12 weeks, 6 week, or how much time you will have to pay for your NCLEX examination, NCLEX preparation. So structured study plan build on your time duration. Then last one is control. You have to control yourself. Yeah, there are too many distractions throughout your whole journey of NCLEX preparation, but you have to control yourselves. Okay, control, that means build a consistency that regularly you have to spend 6 to 7 hours minimum and 12 hour maximum from your 24 hours your day to night plan. Okay, so pyramid to success for RN included strong positive attitude, structured study plan, and control. So all the best for your NCLEX preparation. Now I'm leaving, and I hope that this data will help you to orient to your NCLEX examination and help you to prepare for the NCLEX examination. Thank you.